watching Neurology 101. Today, I'm going to talk about seizures. And this is episode 1 of Epilepsy Education. So hang on tight. What are seizures? Seizures are basically abnormal brain activity that cause disasters to people. And how? If there is sustained abnormal brain activity, then people can have permanent brain damage, permanent function damage. They can even have death. Seeing someone have a seizure is scary. And believe me, even I was very scared when I saw a seizure for the very first time. I was a medical student and I had no idea what was happening because I'd never seen a seizure before, and it was peculiar and mind-boggling to me. A patient started just shaking all over, and everybody rushed in. They stabilized him and gave him the medications, and then everything kind of went back to normal. But what if that person was not in a hospital and was somewhere else? What would you do? What if you saw someone in your vicinity having a seizure? What would you do? And what's the right thing to do? Is basically first aid that everyone should know. So, suppose you're traveling somewhere in a bus, in a train, in a plane, and someone suddenly starts shaking and you find it peculiar, you don't know what to do. So if there are people around him, or if it's a very crowded area, just make sure that there is enough space around him. So help everybody move away. Make sure that he or she lies on the side, so that if his tongue or her tongue has fallen backwards, it kind of lies outside, or it doesn't fall backwards. It should kind of be on the side, and it's okay for him to drool. Make sure that the clothes that he has on is untied or is not tight on his neck. So basically make sure that he or she is ventilating well. If you can make a cushion out of something such as a towel or a pillow somewhere, then just put it under the head of a person who's having a seizure. This will prevent them from having any head injuries. A lot of people try to stop these movements that are abnormal, but please do not make these movements stop, and they would not stop. You'd rather end up injuring them. Make sure that you don't put anything in their mouth during that time, because that would lead them to choke on it, or they can even bite on it and hurt something. Absolutely do not make them drink or eat something right after the seizure, even if they become a little bit more responsive. And obviously call 911 right away, because that will help that person get the best care possible at that time. When a seizure does not stop for at least 5 minutes or more, then it's called status epilepticus or status epilepticus, which essentially means someone having continuous seizures. Sometimes they happen for 5 minutes straight or more. Sometimes they could have multiple seizures without them completely coming back to baseline, and this itself is called status epilepticus. Sometimes they could be completely altered and you would think what's happening, but they could be even having subclinical seizures. So the best thing to do is actually send them to the hospital. How are the ways that you can treat the seizure? If there is some kind of a suppository called diazepam, then you can place that formulation in the rectum of a patient. But the best thing to do is get someone who's more trained to do it. But if not, you can still put it in the rectum. Sometimes people carry these, or not people, but the places like the transport systems might carry these injections as diazepam or benzodiazepine, which people can put in the muscle, because essentially IV injections are the best, but it's hard to place an IV if you're not trained to do it, right? And that's how you can, at your level, manage or give first aid to a patient or a person having a seizure. Other things that you absolutely must note during someone having a seizure. First, look at their movements. See how they are moving, which side they are moving. Why? Because when a doctor will assess that patient, they will try to talk to someone who's witnessed the episode. And here, if you are the witness, you will be asked those questions. And it will be really helpful for the doctor to understand where these seizures are coming from. People tend to have these visual symptoms, hearing symptoms, weird feeling in the gut, and taste, and feeling lightheaded, stuff like that. That is actually an aura of a seizure. In addition to that, note for how long the seizures lasted. Like, was it 1 minute, 2 minutes, something like that. Try to be as accurate possible. And also note that after the seizure, for how long the patient was not completely responsive, because that period is actually post-ictal state, or that's after the seizure, and it helps us understand like how long that was, and whether it's indicative of something, or whether the patient has completely come back to baseline or not. So try to be more and more observant. Another thing that a lot of people will ask would be, did the person have any blood in the mouth? That means, did they bite on their tongue? Did they have any incontinence, like urinary or bowel incontinence? So try to see all these signs too. And that way you can save a life as well. So this was episode 1 of Epilepsy Education. If you have any questions or comments, please put them down below in the YouTube channel comment section area, and I will be happy to answer them. Also, please like, share, and subscribe to my channel. Thank you.